Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. Hi, this is Bob Nickman. Welcome to The Exploding Human. Today we're going to be talking to Elena CLARK-FAHLER, a sex addiction therapist, about all kinds of interesting things in the field of sexuality, how she works with patients, the different types of sexual functions and dysfunctions, the types of treatments that she does, a little bit of about other addictions that sort of tie in with some of the treatment she does. One aspect that I thought was great, we talked about a treatment called EMDR. I'm not even going to explain it here because she explains it really well. But it's a treatment that's also used with PTSD in soldiers, but also is a very valuable tool in dealing with people who have been sexually abused, and how they might use this technique in order to help them. So it's a wide-ranging discussion on sexuality and sex addiction. And please excuse the slight. I recorded the interview on a different type of microphone, so it's a little bit hinky in a couple of spots. It doesn't sound exactly the way I wanted it to, but the content was so great that I just really didn't want to do it over again and take up her time. And I think that you'll probably be fine with it. I'm a little picky about that stuff, but please overlook any sort of sound issues. It's not terrible. It's fine. It's just not the quality that I would love. Anyway, I am so happy that you're tuning in to the podcast, The Exploding Human. So check it out. This is Elena CLARK-FAHLER. How do you define sex addiction?
Well, sex addiction has a cluster of symptoms, and those are compulsive behavior. It's behavior that is uncontrollable, and this individual starts to feel powerless. They want to stop, but they can't stop. Or they make promises that they're going to stop, but they continue to keep breaking their promises. There's also lying, keeping like a secret life. Individuals start to become more focused on their addiction than completing tasks in their lives with their family or work. They find themselves getting lost in it, get out of preoccupation. So getting really preoccupied is a symptom as well. And just really being not present and finding themselves feeling hopeless and helpless. A lot of people suffer from depression as a result of their sex addiction, and they often really feel alone and don't really know where to go. And also there's just this need to want to continue to keep doing it. And many of the folks that struggle with sex addiction often have had sexual trauma in their history, and many times their sexual acting out behavior is just a repetition of the sexual abuse that they encountered.
Well, that was the case with a friend of mine who had a trauma as a young man.
Mm-hmm.
There was an uncle, I think, who was taking pornographic pictures of him and doing all, I don't know if it was, I think there was some contact, I'm not exactly sure, but he was really acting out as an adult with, and he was unable to, the saddest part to me was that he was unable to sustain any kind of actual intimate relationship with someone because of this
because of the behavior.
Yeah.
And so can you tell me some of the behaviors that I'm sure not everyone acts out in the same way or has the same issues. I mean, there's probably people that are more isolated and some that are very active out in I mean, I don't know what goes on out there in terms of,
there's a lot
bars and clubs and hookups and all kinds of stuff that people do.
Yeah.
I mean,
and we live in Los Angeles, so a lot is going on. Well, the thing is that everyone's sexual acting out behavior is very unique to them based off whatever they experienced and whatever they became aroused by. Because, with sexual abuse, there's an arousal aspect as well as a great deal of shame and fear. And so now you've got this combination of arousal, shame, and guilt, and then, this repeating the behavior over and over. And then now you're an adult, and this has became part of your sexual template. It's became part of your sexual story. Because, keep in mind that we are aroused by certain things based off our sexual story. And in our country, we don't really spend a lot of time on education for our kids around sexual health. Many of the people's parents tend to have hang-ups themselves, and so don't really know how to educate their children as well because they weren't educated. In our country, I can't tell you how many times I've seen a client where they've just said, I got one sex talk, or I got sex ed in school, and then the rest they had to kind of figure it out. And if they've had any kind of sexual exposure that was inappropriate for the age, then that starts their sexual story, and then that becomes a part of their way of behaving sexually. And so you ask the question of what do you see, what do I see at least, with people who sexually act out. It can look like a whole gamut of things. And, I see men and women, I see different sexual orientations, sexual genders. It's so fluid. So I work with individuals who are going to bathhouses, restrooms to sexually act out, individuals who are going to massage parlors compulsively. Now, not everybody that goes to a massage parlor is a sex addict. Not everybody that sees a prostitute is a sex addict. It's when it's compulsive and they can't stop, and it's insidious. They're spending money that they can't afford. They're spending time that they can't afford. It's became so a part of their need, want, and inability to stop, and their life becomes unmanageable. So, with women, it might be, because I work with sex and love addicts, and love addicts are individuals who get into these very intense, compulsive love relationships where they might even to the point stalk, and now we have internet stalking, where they might stalk the individual. They can't stop thinking about the person. They're in a relationship that is totally, it fills their time. They're constantly preoccupied. They may even be having a compulsive affair or affairs. So it really depends on the individual. So there can be an individual I can see that have a combination between love and sex addiction. Sex addiction tends to be more focused on the sexual act. Love addiction is really about this addictive relationship dynamic that this person cannot stop. And it's interesting, if you look at all their love relationships, there's a lot of similarities of the people that they continue to keep seeking out. And again, there can be a lot of different reasons why someone gets into a love addicted relationship. They might have had a very kind of incestuous relationship with their parent, or they got into a relationship with someone that began that kind of arousal template where it was very insidious, and there might have been secrecy. There could have, it could be a whole gamut of issues. So sitting down with a client and doing an assessment, I get to know their story. I get to know the parts where they're becoming compulsive, where they're preoccupied. But ultimately, if it's interfering with their functioning in their life, that's where I'm looking for. I'm looking for what's interfering with healthy dynamics, healthy relationship, and ultimately what they want, you know.
I never thought, I never thought about like love being an addiction. But I understand.
It's a bad name for it.
Well, yeah, I have another friend, I'm going to tell you, and it's not me.
Okay.
It's a friend.
Oh, okay.
So when I say it's a friend, it really is a friend. Because when you talk to the therapist, you go, I have this friend, and they go, okay, it's you. He told me once, he said, he goes, don't you just love the newness of a relationship, how exciting that is?
Yeah, it's great.
And I was like, well, yeah, I mean, I've had that, but he's been married like 5 times because he wants to keep recapturing that.
Yeah.
And certainly when you're 12, 13, 16, 8, those teenage years, it's an incredible high to fall for somebody and to be thinking about them all the time, and that seems to me fairly normal.
Right.
But to try to recapture that, there's a level of, in my mind, it's unrealistic, and it seems immature to me, and it seems unsustainable.
But it's in our stories, right? It's all through our stories, types of life where, we're gonna fall in love, and then it's interesting when you get a couple that comes in and they say, we're not in love anymore, and I say, well, thank God you're not in love anymore. Now you love each other. So now let's actually work through a real relationship, which there's conflict, and you got to work through differences of opinions, backgrounds, histories, religion, and you have to learn how to negotiate and cooperate. And when you're in love, you see past all that stuff. You just go, oh my God, this person makes me feel whole. This person makes me feel euphoric and excited, and sex is amazing. And then there comes life where this person becomes kind of like, an old shoe.
Well, you better be friends.
Yeah.
Well, I was just curious. I mean, when you say that, almost like stalking, is that really the heart of stalking? Is that someone becomes obsessed and thinks that this other person is going to solve every issue that they have in their life?
Yeah. I mean, look, there are some people who are psychotic, delusional, and they may be stalking for those reasons, but when you are so addicted to a relationship and you feel, and honestly, a lot of these folks have had some level of abandonment in their childhood. So maybe they had an abandoning father or an abandoning mother, and they longed for this person, wanting them in their life and missing them, and it's like they just keep repeating that story over and over and over of that abandonment and that longing, and so ultimately when you're feeling this feeling inside of you, you want it to go away, and so part of making it go away is looking, watching, following it. Like it kind of, if anything, it makes it worse, but it also kind of just gets this person to kind of exhaust that energy and let it go, because otherwise they're staying preoccupied with it. Now there are some people who I work with who violate other people's boundaries. Now what we call those folks are nonviolent sex offenders, and those are like our exhibitionists, our voyeurs. Those are a little bit more serious of a sex addict. So I get individuals that come in where they're following people at the grocery store, or circling the neighborhood, exposing themselves, looking in other people's windows and violating boundaries. Those folks are a little harder to work with because they really have set up a lot of defenses in their mind to really believe that they're not doing anything wrong, and that they have a right to do this. And so I have to really work with them on changing that thinking that they actually have the right to violate someone else's boundaries. And usually it's fueled by anger and rage. A lot of people who are exhibitionists or voyeurs tend to be very rageful people. And so they act out their anger through violating other people's boundaries.
Well, it is an aggressive thing to do.
Oh, yeah.
Well, but it's interesting that somebody would come to you with an issue, and yet they don't want to look at the responsibility part.
It's a lot of pain under there. Like, feeling your feelings is very uncomfortable for people. Like, I really love Dan Siegel with Mindsight and meditation and mindfulness and the Power of Now with Eckhart Tolle, and because we have to learn as a human race, as a species, to learn how to sit with what is versus acting out our feelings. And a lot of sex addiction, love addiction, and all these types of compulsive behaviors are people acting out feelings versus learning how to sit with them and understand them and cope with them in different ways. And so when clients come to see me, we first identify what is the pattern, why they keep repeating the pattern, what's the story they keep doing over and over and over, because it's insidious and it's insane and it's making their life unmanageable. So we first have to gain awareness, right? The next step is, okay, now we have to develop skills. Okay, we have to develop skills and to work with this emotion that comes up inside of you that you can't control. And then from there, you need to know when to apply these skills in real time. So, it gets messy, and that's why we call it recovery, because there is no, like, you reached the, promised land and life is wonderful. I think over time, people learn how to maintenance it and work with it, but they may always have that part of them that just feels that they want to play that story again. They just have to learn how to become aware, learn how to see it when it comes up, learn skills, and then learn to apply those skills, and then ultimately maintenance. And then look at what they really want. Like, what do you really want? Do you want a sustainable relationship? Well, for many of my clients, a sustainable relationship is boring. And it's like, well,
because it lacks the excitement of something new or something
there's no euphoria
dangerous.
And dangerous, and it's like, well, you need to get that from other stuff like deep sea diving or like go for a hike. I mean, you have to, but those things tend to be less intense than playing out the story over and over and over. It's interesting, like watching this show recently called Affair. And it's like this guy just gets in this affair, or both the man and woman, they both are cheating on their spouses and get into this relationship, and just so distorted about what it was or what it is and where it's going. And I think there's sometimes we keep wanting to play out some kind of adventure story that just keeps wrecking other people's lives.
But it's a way to make your own life maybe more than it is.
Called drama.
Yeah. They're
and we're addicted to drama, aren't we?
Well, yeah, and I always wonder, like, how much role does the media play in this? Because, growing up in this country, and I'm watching television or movies, and it's so charged with beautiful people and making, there's always music when there's sex.
Welcome to LA, right?
And it's LA, or just even in the movie, and it's like this isn't real. I mean,
no.
I don't understand. Like everyone in this movie or television show is gorgeous, and they're all having sex, and there's no consequence, and if there is, it's solvable. And then you have just sort of the regular people walking around going,
now think of porn. In porn, especially in the Valley, we got a lot of porn going on over there getting filmed, and most of the people filming it, or now a lot of people are filming it in their homes now, but it's drug-induced. Individuals are often have had some sexual abuse in their life, and they're trying to make some money, and it's not real. It's not real. And now we have it so accessible to our phones that kids in junior high are looking at porn and starting to really believe that this is what real sex is, because there's lack of education going on in our country and lack of education going on at home. So the only education they're getting from is the internet, because it's a huge encyclopedia, and this is going to be interfering with real relationships. Real, like real relationships. And our country hasn't gotten it yet. And porn is $1 billion industry. And, and I'm not against porn. Like, I'm not saying that, oh my God, what I'm saying is that there is such a culture right now where we don't really connect. And we're getting this information from what we see versus having real conversations about healthy and connected sex. Because there are some educational porn videos on actual eroticism and real relationships. But that doesn't sell. What sells is just raw, intense
wouldn't
sex.
even know about something like that.
Right, okay.
No, you always think about, well, it's all about the mechanics and,
right.
the athletics and the, stamina and...
or plastic bodies. Not real bodies.
And, and also, I've watched porn and felt worse afterwards in the past. Like that was weird. I'm like, why am I watching other people, for one, and two,
we all have this voyeuristic kind of nature, don't we?
Yeah, and then it was never
it's
like
called television.
Yeah, right. And I remember like watching it with a friend of mine. We were watching, and then we went out to do some shopping at this, and I go, I'm looking at every woman as like a sex object now, and if they're friendly, I'm thinking, that's the girl from the movie attitude, and and I'm like, this is
or
really...
we'll name women based off a body part, like especially with like rap, and again, like my children listen to rap and hip hop and stuff, but it's interesting in the rap, there's just like discussion of a woman as an object, not a human being or feeling connected or nothing,
Well, just the words that are being used. Hoes and bitches and...
Yeah. And even worse, I think a lot of it has to do with women have a lot of power. And, to objectify a woman or put a woman kind of in a box, there's a sense of feeling powerful. And, we could go off on a tangent around all this, but, there are some people who came into my office and have had some really horrific stories about their relationships with their caregivers, early caregivers and how they were treated. And there are people walking around with a lot of anger and a lot of pain, a lot of trauma, and just playing it out over and over and over and over,
Yeah, it seems like most of this stuff is rooted in childhood, I would imagine.
It starts there. And then over the course of their relationships with people in the community, at school, and, and if they were bullied or, this all starts to impact a person and it shapes a person. And then now you have an adult walking around and maybe walking around with a lot of pain. Because I have to say, most of the sex addicts and love addicts that I see, they've had a story of pain. It's not, I don't think I've ever had this like person that came from a perfect little childhood and life and came in, I think I'm a sex addict. I don't see that. Most of the people I've had, and that's why I do trauma work as well, because most of the people that I see have had some sense of trauma. And it's interesting, I did an interview some time ago, it was on television, and I was talking about sex addiction. They were asking me lots of questions, and I found myself constantly going back to trauma. And I was like, oh my God, I kept on saying, and they hated to hear this word over and over and over. They wanted to just get into the story of like those guys and how bad they are, and this poor woman's going through so much pain, and this man is such a sex addict. I'm like, it's not that cut and dry. There are men and women that come to see me, and I have to say, most of them have had trauma. And so I think that it's really important that individuals understand that it's not, it's not so cut and dry that there are people out there that just want to go out and hurt people, but they're actually playing out their pain, you know?
Absolutely. I think, is there a lot of cross addiction? You know,
oh my gosh,
are
yes.
most of the people that come to see you, they have other issues with drugs or food or...
Yeah, and that's why we call our group practice Recovery Help Now, because most of our clients have some kind of eating disorder, combination with sex, or chemical dependency. I mean, you have to think about it. When you're a teenager and you're going through, puberty, and you're feeling attracted to someone, and you feel awkward. Everyone feels awkward. You feel awkward and uncomfortable, and then you're in a social setting where you're with someone you're really attracted to. Well, drugs and alcohol is a great way to kind of soothe that in order to feel more connected to another person, to actually find that liquid courage to go, okay, I want to be sexual with you, I find you attractive. And if you think about it, more and more kids are looking at the internet, so they're using that as their educational tool to connect with people.
Mm-hmm.
Okay, and they're also feeling really awkward and uncomfortable, and so there's definitely a lot of combination with chemical dependency, alcohol, and sex. And you put that combination together, you can start seeing a lot of damage happen.
You must see people that only act out when they're high.
Yep.
They can't do it unless they're a little bit.
Many.
When I was in college, I had a girlfriend who I discovered was very promiscuous, and
How did you discover that one?
It was
too personal.
Yeah. No, I mean, I caught her cheating. So. So.
That sucks.
And, yeah, it does.
It does.
And. I remember talking to her about this a little bit and saying, because she was sleeping with a lot of guys, and I said to her, can't you just be friends with a guy without sleeping with him? Why do you have to sleep with all these different guys? And she said, it was the most interesting response, which I did not expect. She goes, it completes it. It completes the friendship and that. And I go, I don't know what that means. I don't even...
Well, she probably got her sense of self-worth.
It was an interesting response. I was like, well, you're not for me. But yeah, go ahead. I'm sorry.
Well, it definitely creates a sense of self-worth. Like, for many people, they get their self-worth from being sexual with another person. Like, I'm enough. I'm worthy. I'm good enough.
Yeah. Well, she turned out to be an alcoholic, and she came from an alcoholic family. Her father was an alcoholic, so, those types of behaviors seem to, pass along in families.
Yes.
And in this case, it manifested in two things.
Yeah. And also, too, some of the people that come in are struggling with depression and anxiety, and I have to be honest, there's some people that came in who have obsessive compulsive disorder along with sex addiction. So, like, maybe instead of stamp collecting or checking a million checking the stove a million times, it might be checking the internet for porn, looking for this particular image, and seeking it until they find it, So there can often, I don't typically see anybody who's just straight up struggling with sex addiction. They typically will have a mental health issue going on, like depression or anxiety, and or a substance abuse issue or food addiction. And you got to get to know their patterns. Like, some people will act out sexually and then eat afterwards to soothe because they want to get rid of the guilt and shame. And then, it becomes a part of their sex addiction cycle, or what we call addiction cycle.
So, it's exactly like drug addiction.
Mm-hmm. Very similar. There are differences. What we call it is a process addiction. It means it's very similar to kind of like gambling or food. It's not, or video game addiction. It's not substance that's going inside of you. However, it gives you the same kind of dopamine or euphoria or serotonin that an actual drug would give you. You know, it's giving you the same, like, energy. And like, for instance, if you're a very depressed person, you're not getting a lot of dopamine. You know, you're probably really isolated, not taking, you know, like, you're having really worry thoughts. Well, when you have sex addiction, you just get that moment of, like, spark or enoughness to be able to operate in your world. But it's insidious because it keeps bringing back the depression, because you feel the guilt and the shame, and it just makes the depression worse, causing the addiction to just keep getting worse. So many people use their addiction to actually cope with their depression.
How prevalent is this, compared to, let's say, alcohol abuse, or, overeating, or, because, I mean, you see those things, they're very out in the public.
Right. And they don't have a lot of shame.
Not really. I mean, no, drugs and alcohol did, but now it's almost fashionable to be a recovering addict.
Especially in LA.
Yeah, in LA anyway. And, food, I mean, people, there's Weight Watchers, which is not, that's one way to deal with it. And there's a lot of people that are, there's an obesity problem that's being talked about very
sex
openly.
Addiction, you got to go to a tiny little dark hole of a meeting where nobody is, where you got to keep the secret. I mean, there's so much shame and secrecy around sex.
I think religion has a lot to do with it too.
It has a big part of
that. It's child sexual abuse. There's a lot. It's still not being talked about in the way that could help a lot of people.
Well, I used to work in the Santa Monica Rape Treatment Center, and it's a treatment center where you can go and it's a forensic hospital where you can go and after a sexual assault and report what happened. And so I would meet up with a lot of victims, and at that particular place when I was working, we did a lot of education, and what we found, and that was in 2000, and at that time the statistics were showing that 1 in 4 girls are sexually abused by the age of 12, and 1 in 6 boys are sexually abused by the age of 12. So that was in 2000, and again, a lot of people don't even report sexual abuse. So, often when I'd go into high schools and do education on sexual abuse, and we also offered crisis counseling right afterwards, there would probably be, 36 kids in a classroom. We're looking at, a great deal of kids in that classroom, and were probably being sexually abused, and so that many of them would come and see me afterwards, and I would report child abuse. And
when you think about that, if there's 36 people and 1 in 4, that's 9 girls and 6 boys in that class
that could be sexually abused.
Yeah, that's an enormous amount of people,
and nobody talking about it.
Nobody, no.
And so going out, that's a big part of what we would do, is go out and provide education, and also provide a place where people kids could come and report. And so I made a lot of reports. I got really good at making reports and getting these kids help.
I like to blame Puritan culture is where we started.
Well, it's kind of like this. We could blame the religion.
I want to find a blame.
Or blame those that hide behind religion to continue to keep doing what they're doing.
Well, that's certainly an issue.
I kind of look at it that way, because there are some definitely very good people who are religious.
Absolutely.
And find that having a doctrine or a structure really supports their lives. That's all good. That's not my way. I'm very spiritual, but for some people, that's really good for them. And there are people in that congregation that may use religion to continue to keep doing what they're doing. And that's what's dangerous, is that then we're looking at religious abuse, sexual abuse, and anything else that might be affecting.
Well, it is so prevalent it's come out in the last 10, 20 years, an enormous amount of that thing going on where you shut down the people, you shut down their sexual life completely, and then they're religious people, and then they're in charge of kids,
right?
And so they've shut down a part of their who they are, and then it's coming out, squeaking out the sides in a secret way, and then there's all these people that are victimized.
Right.
It's an interesting thing, and this is just an aside, how it's almost a genius thing where to manipulate people when you say the very thing that human beings are, which is energy and life force, which is sexuality tied to that, is bad. It's and then so everybody is guilty now, and you can say, well, those thoughts that you're having, sexual thoughts are so you're controlling with guilt, and taking this very thing that human beings are, which is sexual, and making it, and then you've got this whole culture where everyone is not being truthful about the essence of who they are.
Yeah.
And I'm not.
Well, it's also too, like, I'm in my 40s, and my parents are in their 70s, and when I was a kid, it was considered, children are to be seen and not heard, and children are property. And so in many ways I was treated that way. I was treated that my voice didn't matter. You're just, kind of along for the ride, and be quiet in the back seat, and so we can go on our vacation. So the thing about it is, when you start treating people like objects, when you start treating children like their property or their objects, then that's when it gets dangerous. This is where people can come in and see a neglected child, and take advantage of them, or people who look at someone as an object will treat them like that, and that might be hitting them, hurting them. And so now that we're moving out of a culture of treating children like property, now we're looking at children as these little humans. The other thing is that we have to look at is that we also have to make sure that we understand that we're educating children to learn to no longer need us. We need to educate our kids so they can go out there and survive. So it's about finding that nice balance, between really being able to be there as a support and an educator, and encouraging them and supporting them in the community, and valuing who they are and valuing them as individuals. But when those things don't happen, things go awry. And so kids in religious communities, where there's a nice little Pathfinder guy, or or leader, scout leader, or pastor, can prey on a child because this child is so hungry for connection. So that's what we have to look at. It's not so much about the religion, or it's this perfect storm of aspects that create this problem. There's neglect, there's treating people like objects, so this person has a lack of connection, and then they're in an environment where they might have someone who could take advantage of them. And then we look at them growing and moving on, and then they can start having problems as a result of being abused, and continue to keep playing that out over and over and over, creating the cycle to keep going, which is maybe they're neglecting their child because they're so focused on their sex addiction, or not available, because when you're caught up in that preoccupation, you are not available to your spouse, to your children, to your family, and now we're repeating the cycle again. So I kind of look at my work as changing these patterns and helping people really start getting connected. A big part of why I have a group practice is because I believe in groups. So we work together as a team. Also, we have 5 groups, like process groups here too. So I work on helping people connect and work through conflict and work through interpersonal skills, because we have gotten to this place where you just can show people who you think you are, or what you want them to believe about you, versus who you really are. And so a big part of my practice is about doing group work and connecting people. I kind of really believe where there are two or more, there I am. And so, there's something very spiritual about coming together as a group, such as in AA, where, the first word of the first step is we. And so I just think we've gotten away from that as a society.
Oh, that's great. So you do group therapy also? Yes,
group therapy, couples, individual. And I find people change the most through group. I really do.
Well, there's something about that where you don't feel alone.
Right.
I mean, one-to-one therapy, you can still probably, I've done some therapy, but sometimes I would think, well, how am I going to apply what I've just discovered?
Right.
And it seems sometimes you still feel like not quite connected, even though you may have discovered something about yourself.
Right.
What are when you say you work with trauma, are there certain techniques?
I do EMDR.
Okay, tell me what that is. I love these names, these acronyms.
Eye movement desensitization. People think it's kind of voodoo, but the reality is now insurance actually acknowledges it, and it's based in research that it really works.
Okay, so it stands for
eye movement desensitization reprocessing, okay. EMDR.
Okay.
Because when Francine Shapiro started this treatment, basically what she was doing, she went for a walk and she was thinking of something very traumatic, and while she was going on this walk, this nature walk, her eyes kind of fluctuated back and forth, and all of a sudden she found herself calming down and started getting clarity about what she was really thinking about versus getting kind of caught up in the traumatic reaction of it. And so she was like, quickly brought this into her research and said, does this eye movement going back and forth, which is called bilateral, this eye movement going back and forth, kind of like if you remember when you were a kid and you watch these movies of somebody with a watch, and they were hypnotizing,
yeah,
you're like,
sure.
You're getting very sleepy, right?
Yeah.
And you're watching the watch go back and forth. Well, that's bilateral stimulation, and what that does is it calms you down. Because in your hippocampus, you get really fired up. That's our survival. That's our fight, flight, or freeze response. So the reality is we're animals. Okay, a lot of people don't want to realize that we are animals. Okay, we have a frontal lobe. Yes, we cook. We make fire. We are a very unique species. But the reality is we're animals. Okay. And we still respond like animals in many ways. So we have fight, flight, and freeze responses. And when we're dealing with something that's traumatic, we go into survival mode. And so when you go into survival mode, you cut off from your frontal lobe. You cut off from your intellectual thought. And so you might start doing things or behaving in certain ways that are not logical. Okay, that would be like our Spock, right? That's not logical.
Sure.
It's not logical because it's emotional.
Right. It's just a visceral reaction that you can't even think. You're not thinking. You're
acting from a place of survival. So when people have trauma reactions such as flashbacks, or they start to re-experience something very flooding, EMDR, I'll get back to the EMDR for a minute. EMDR helps individuals get out of that response and has them reinterpret the story. So we have a story in our mind that we may know or not know, and then we react from that story. Well, EMDR helps you reinterpret the story so that you respond differently. So like, for instance, what you do is I'll take a memory, a traumatic memory, bring that into their mind, and like, let's look at this memory, let's feel the memory, let's be with the memory. What did you make up about this memory? And they might have made up that they're not good enough, or they're bad, or they should have done something different. That's what you hear from a lot of trauma survivors, is that it's my fault. Well, they saw that image, and their story is that it's their fault. So what do you want to believe? I'll ask the client, what do you want to believe about that image? Well, I want to believe that I had nothing to do with this and it was not my fault. Beautiful. That's where we want to get to. So basically, we go through a number of sessions of bringing up that memory, which is very anxiety provoking for people. And part of post-traumatic stress disorder is avoidance, is not to look at or see pictures, not wanting to. Avoidance makes the symptoms worse. So what we do is look at it. Let's look at it, and we're going to look at it and look at it and look at it and look at it, and you're going to have these responses come up in the session. We're going to use the bilateral to bring down the intense emotion so that you can access your frontal lobe and create a new story about that event. And you do that over and over and over and over. At some point, somebody just says, oh God, okay, not my story anymore. Now I'm starting to really see that this had nothing to do with me. And so the clinician may have to challenge some of the cognitions, while this process is going on, to help this person kind of see it differently. Because what happens when people with trauma, especially if they go into those fight, flight, or freeze responses, is that they get really rigid on what they think and believe. And so EMDR helps people get flexible to see it in a very different way. So now when they might have that, let's say for instance, let's say a person who's been sexually abused doesn't like people getting close to them, okay, and which is very common. So let's say somebody gets, they've done a series of EMDR. Instead of perceiving that when somebody gets close to me, they're going to hurt me, they might go, okay, this person's getting close to me, I'm having a reaction, but I'm going to breathe, I'm going to use my coping skills. This person's safe. It's okay. I might ask the person, can you move a little further away from me, just a little bit? I'm kind of weird that way. I don't really like too much touch. And then the person, oh, certainly, that's fine. So you get to say, well, I'm going to accept that I might have this reaction, and I know what this reaction is about, and I can apply a skill, and I can ask for what I need and want. So it may not make it go away, but it causes the individual to respond differently versus the person getting really stiff and really, reactive and not being able to have a voice. Okay? And then re-experiencing the trauma again. Does that make sense?
Yeah, absolutely. Is it like a relaxation technique?
Well, the bilateral
to get to the bilateral
calms.
How do you do that? How do you
physically
do that?
There's a lot of different ways that we do the bilateral.
Okay.
That's these tactile buzzers, like zzz, zzz, zzz,
so you hold two buzzers in each hand, and
it'll go back and forth with the bilateral.
Oh.
While they're going through the image.
So they're squeezing it and making a noise.
No, it's buzzing in their hands. They don't squeeze it at all.
Oh, okay. Are they creating the buzzing, or it's just an ongoing?
I create the buzzing. So it's a little machine where I'll turn it on and I'll help them. They'll tell me what pace they like.
And it goes back and forth from one hand to the next.
Kind of like a vibrator. It's like a little vibrator in each of their hands, and it goes zzz, 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 tactile.
So there might be a certain pace. Do you ever pick the pace up? Or?
The client picks the pace.
Wow.
And then there's also the eye movement, which is the eye bar, or you can use your, Francine Shapiro started with just literally holding your two fingers up in front of their eyes and going back and forth and follow my fingers, kind of like that watch going back and forth. It's very similar to that. It's like,
is that something someone can do themselves once they learn a little bit?
Yes, they can actually do something what we call a butterfly, or they can put their hands on either leg, like on their lap, and just pat back and forth, pace it back and forth, and that can bring down the emotion. A butterfly is when you cross your hands on your chest, and then you just kind of tap your shoulders or chest back and forth, really lightly back and forth, and it can just bring down that emotion. So, it's kind of like rocking. People rock.
Yes.
Well, people rock because they're trying to soothe.
It was interesting that you crossed your hands, because I notice when people are uncomfortable, just in regular...
They guard themselves.
Yeah, guarded position, but you're saying do the guarded position, but then tap on either
back and forth.
shoulder. arm, and that makes it. And you're thinking about the trauma.
Or if they're doing this by themselves.
I'm just curious to see if someone's
doing it to calm down.
Yeah. Okay.
Yeah.
But it does help to be able to discuss it with somebody and be guided.
Yeah. And so it's moving away from let's not talk about trauma, but let's actually talk about it and keep talking about it and keep talking about it, keep talking until you start creating a new story of it.
Well, I like the idea of just getting, if it works, which it sounds like it does, just getting to the point of going, I'm done.
I'm done with this story.
And I know that they're using this a lot with the veterans who've had PTSD, which is a serious problem.
So it doesn't make it go away, but they interpret and cope with it very differently. Basically, EMDR just creates enough gap or space to respond differently.
And what's the average time that someone would see you?
It depends.
I know.
It depends. If somebody has complex PTSD, which is like they've had ongoing trauma for a very, very long time, that could be a long process.
Years and years, I would.
Well, yeah, I mean, it's long-term treatment.
Yeah.
But if you're looking at an isolated situation or something that happened, a couple times, then we're looking at probably 6 months, 3 to 6 months.
Mm-hmm. And do you also recommend continuing with like a 12-step program to your clients?
For people in recovery, yes. So like if we're looking at our sex addicts, there's several different meetings. There's SA meetings, which is Sex Anonymous. There's also SAA, which is Sex Addiction Anonymous. There's SLAA, Sex Love Addicts Anonymous. There's SCA, Sexual Compulsive Anonymous. There's also LAA, Love Addicts Anonymous. And then there's S-Anon, and S-Anon is the equivalent to Al-Anon, but it's for partners who have been affected by their sex-addicted partner.
That must be a very difficult thing to stay in a relationship like that, to be...
It's very hard for partners, and I see partners as well.
Yeah, because you're in love with somebody, but they're doing this other thing that's really damaging. Mm-hmm. That must be not a big survival rate in those relationships, I wouldn't think.
It depends on the level of damage. It also depends on the length of the relationship, and it depends on the quality of the relationship and the client's commitment, to their recovery. Because, if you have somebody who's just constantly acting out all the time and they keep hurting the relationship, well, at some point people get fed up. But if you have someone who's like been found out, they're getting into treatment, they're really making their recovery a priority, then I've seen partners really hang in there, work with them.
That's extraordinary level of love and forgiveness to be able to do something like that.
Well, look, we're not wired to be anonymous, and and when I say
you mean
that,
monogamous? Yeah.
We're not wired to be monogamous.
Yeah, you said anonymous.
Did I?
Yeah.
Oh my god. Wow. Okay. Well, maybe we're not wired for that either. But yeah, we're not wired to be monogamous, and why I say that is that, again, is this going to religion and like. Look, when you make an agreement and you say, I am in a monogamous relationship, this is what I want, and then you violate that contract, you're in violation. You've done something horrible.
Right, broken an agreement.
And
intimate agreement.
Yeah, and then so we work with the repair and help the partner and the couple work back together towards recovery and to really change the dynamic of the relationship, because there's probably some things in that relationship that aren't working that need to change, such as the partner needs to focus on his or her recovery of self-care, okay? Because Al-Anon and S-Anon, their focus is self-care and taking care of yourself, not focusing so much on the addict and trying to manage this person. And I really see couples repair it and change it and forgive and move on. So the only reason why I said we're not wired to be monogamous is that, when we make these very large statements of you need to break up with that person and get them out of your life and da 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 da. Well, that is an option, and that might need to happen. However, there's other options, and there is ability to forgive, and it's not to minimize that pain, but it's a lot more complex than what the average person might be going through. Like, they may have history, they might have investment in the relationship, they might have kids, they may really actually love each other, and they, so anything's possible. And I think when we get too caught up on the monogamy, then someone might actually end a relationship that had a lot of legs there to keep it growing, and so I've seen some relationships end where I was like, there was enough there. Like, they seemed to really love each other, but they were kind of pulled from their community to break up.
Yeah.
Because of this very staunch, monogamy, and it's wrong, and they shouldn't do that, and I get it. They should not have. They made an agreement. They broke that agreement. But we have to understand that relationships are a lot more complex than just, in the box or out of the box. And people can heal, people can change, and can recommit. So I just encourage people not to just go into a very singular thinking.
But, when you say we're not wired to be monogamous.
Right. We're not. We're attracted to, we walk down the street,
right.
Like, whoa.
Well, right,
it always. Hey, you.
No,
but not everybody acts on that, right?
Right. No, but I that's always fascinated me.
Yeah.
It's like I can't be expected, or no one can be expected to shut off, an initial attraction to seeing, someone that's attractive.
Yeah.
But we don't, as human beings, it seems like we want to have that one person. So
right.
it's like this dual thing going on in each person, I think, to say, well, that's, is it a maturity thing, or is it, one is more powerful than the other for most people to want that connection?
Societal too.
Yeah, but I mean, are there societies that none of that's a big deal? It's like you're my partner, but I do other things, and I find that very odd for myself.
Yes.
I don't think I could split
complex.
my head like that. I think it would only create problems.
Yes, it probably would. I mean, it's a lot to manage. But there are cultures out there that, or even our culture, like even Southern culture, where someone has had an affair for years, and it's like, as long as I'm the primary person that you care and love for, that's what matters. And then the secret is that you have this little affair on the side for years or whatever, and I look the other way, but we're together, and there's an unspoken agreement on that. Now, people looking in might judge that, and that's why it may be kept secret or whatever. But the reality is that there are many couples that operate like this.
Well, I think that used to be even a greater.
Right.
It was like in some cultures it's accepted. It's the husband. Usually the husband has the extra thing going on.
Yeah, that's.
The wife is home with the kids.
I think women just know how to keep it on the down low.
Well, maybe,
better.
Yeah, but that's less. Probably that's probably less acceptable.
Yeah.
Like the powerful. I'm picturing some powerful, wealthy guy, and he's got an apartment with some young woman in there, and he's taking care of her, whatever.
That can happen. Yes.
And the wife's at home, doing, and she doesn't want to because she's a mom. Something like that.
Yeah.
That's sort of the stereotype in my mind. And then that was very accepted, and I'm sure in some cultures that's just a given. And maybe it's an unspoken, and maybe in some families they actually know about it, and it's just not talked about a lot.
I mean, even some of the monarchies, when we look at, they married because of status and,
arranged marriages.
Yeah, and then there's somebody on the side. And, we see many stories and watch many stories of this. And there are those types of relationships that are out there. Now, again, that's not my story. It's not something I'm interested in. However, who are we to judge? And that's the thing is that when people come in to see me, there are all kinds of different agreements that these individuals have made, spoken and unspoken, and I am not to judge that, but to understand where they want to go and how do they want to heal. And let's look at all the potential risks and consequences. And if you can live with them, then I'm there. So the thing is that, I even have couples that come in that are, polyamorous, where they're having a relationship with another individual that's included in their relationship. Like it could be 3 individuals or 4 individuals that all know about each other, that are very transparent, and they have a certain agreement. And some of those relationships work very, very well, especially when there's very clear boundaries, and some of them don't. And so those couples can come, they've seen me as well. And again, I have to understand what do these individuals want? What do they envision, their life, or how they want their relationship to be? And we have to look at what's interfering with that, what's working, what's not, and ultimately support them where they want to go. So again, this is kind of off the track of sex addiction or love addiction.
Yeah, but it's interesting.
Yeah, it is interesting. But I'm a sex therapist as well, so I work with sexual compulsion, but I also do sex therapy.
Which is
what's working with desire issues, orgasmic issues. So for men, erectile dysfunction, premature ejaculation, or delayed ejaculation. For women, maybe more like vaginismus, which is a pain, compulsive. Like it kind of feels like Charlie horse in your vagina. It's just very pain, basically pain during sex.
So those are rooted. They're not a physical issue. You're saying they're a lot of them are rooted
they have to get
emotional.
They have to get that ruled out and see their gynecologist or a
so sometimes it is just that.
It is, and then sometimes it might be low testosterone or whatever. So we have to really get them thoroughly checked with the doctor first, and then if all of that's ruled out, then it typically can be psychological, and so we work with working with those issues as well. Yeah. So sex is a complex thing, and so if you're just trained in one area, you lose sight of everything else.
Yeah.
So when I first started in sex addiction, I was just trained in sex addiction. I worked at Sexual Recovery Institute with Rob Weiss. At that time, Alex Katahakis was working there too. She owns the Center for Healthy Sex. And I was trained by the best. Patrick Carnes. He was Rob's mentor, and he would train us as well. All the bigwigs. And so I really got a sense and a grounding in sex addiction treatment. But what I found in all of those places is that there was a lack of sexual health discussed or sexual education, and so that's when I got my certification in sex therapy as well.
What do you think the best way to, that's what I was going to ask you next, about sex health, not physical health necessarily, but the entire idea of educating. At what age? How do we do it? Do we do it in schools?
Yeah. That's such a great question.
Is it does it have to be done in the families? Because it's so. Everyone's so particular about the way they believe about this stuff. And how do we raise a sexually healthy? How do we make our culture sexually healthy?
Education, and that means.
And what's the way to do that?
Speaking to children, age-appropriate information. Ongoing. So it's not a conversation because of course everybody's had the talk. It's numerous talks over the course of their development. So at 5, having conversations about how babies really come into the world, and making it more conversational. It shouldn't be something like, we're gonna sit down, and we're gonna have this conversation.
Close the door.
Yeah, it's like making it a conversation so that the child feels very comfortable to have a conversation with their parent. And obviously the parent needs to be appropriate, like what words. Like you actually don't want to give kitty names for body parts.
Yeah.
So it's really important to use real words like vagina, vulva, or penis, not to go into, call it your peach or your special little precious spot or whatever, that's not, no.
Silly.
It is. And it's really important to educate your child. And then as they grow, you're continuously educating. And now parents really need to educate around the internet and the use of the internet, because now kids have phones and they have total access to anything and everything.
To things that are so
damaging.
Off the tributaries
exactly.
that go way out into things that aren't even porn or beyond that kind of stuff.
It's now in our society, it's very interesting. If you are an individual that is looking at child porn, or a child that looks under the age, or somebody that looks under the age of 18, and you're looking at these images, it doesn't even matter if you're 15, if you're 14, and
really?
You're looking at age, somebody that's 14.
Yes, it's still.
That's child porn, and so now we have you can go to jail for looking at child porn, and that's totally appropriate. The thing is that our laws aren't really right now understanding that there are kids looking at porn, and they are looking at stuff that is their age too, as well as adults.
But an adult probably had to make that porn. That's where it's really
exactly
icky.
And see, we used to have it where you go after the individual who made it, but now it's it's reportable if you're viewing it, and which is important.
Yeah.
It's just that more and more people aren't going to go to treatment because they don't want to have a
legal
report against them.
Yeah.
So, it's complex.
Sure.
And controversial.
I was just remembered. I was thinking, well, what was my sex education? I remember I think it was 6th grade, they started it at my school, which is probably not a bad time to start it, but it was.
I think you're supposed to. Honestly, I think
earlier.
It's really important to start talking to your children
at home,
age appropriately.
Obviously.
5, 6, 7, 8, 9, 10, and again, age appropriate, and having numerous conversations.
Right.
It's not just one.
Well, I just remembered there was it's like, we're going to have this thing. Parents had to sign something. They still do.
Right.
And I remember they showed a scare movie, almost like Reefer Madness.
Yeah, like, don't have sex.
Well, yes, and it was this girl, and I remember her name, Phoebe, because that was the title of the movie. And poor little Phoebe didn't listen to her parents, and she got pregnant.
Oh Lord.
And I just remember scenes of her running to the bathroom in the first trimester to throw up and keeping it a secret, and her entire life just fell apart. Now, poor little Phoebe, and the music was this
dramatic.
Yeah, and I remember thinking, wow, why are they if this is something everyone does, why are they scaring me? This is not right.
Yeah.
And it was really more on the girl's responsibility.
Oh wow.
The movie, and
it's interesting, the objectifying women and also now making it their responsibility.
So that was my first introduction to the evils of sex. But then they had a thing. Then they were going to discuss menstruation, and they sent the boys out of the room to only talk to the girls. And I remember going to the girls afterwards saying, "What did they talk about? What was going on in there?"
None of your business.
Right. Well, we can't say. And then and kids are giggling, and by the time maybe 12 is way too late because you're giggling.
Yeah.
And you're not. It's
and that's shame, right? Like people giggle because they're uncomfortable.
Yeah. I mean, just somebody saying the word, balls in front of a mixed crowd at 12 years old. The guys would be giggling and looking at each other, and it's
Look,
just.
I'm giggling now.
Yeah, right? Because it's. I mean, there is something funny about all that, but why should it be? It's just it's like we all have these parts, and it doesn't. Right. It's not. But that was the early sexuality, and I here's another story just because it's so silly. I had heard about when I was about 12. I had heard about masturbation, and I heard about rubbers. I didn't know they weren't called condoms, they were called rubbers. And I knew that women went to the hospital to have their babies. So this is what I made up in my mind. That when a couple got married, they would go to a hospital, They would each lay on a gurney next to each other. Okay, there would be a doctor there who would run a rubber tube from the man's penis into the woman, and he would masturbate, and the sperm would go into the tube into the woman, and that's how she would get pregnant.
That sounds horrible.
Right? And I remember freaking myself out. I go, I don't want to do that. But that's how kids think, unless they're educated. And I was like 11 or 12, and I'm thinking this stuff, and no one had told me anything.
Oh my goodness.
It's a funny story.
And then you become an adult.
Yeah. And not one hospital would take me and my wife to do this process. But isn't that strange that I walked around believing that?
Well, no, it makes sense, right?
Yeah.
And,
I mean, it was all bits and pieces of information I had gotten from other kids and little things.
And then think about kids who are educating other kids.
Well, that's what I'm saying. That's where I got the information.
My first time, one of my friends told me, I was in junior high, and she said, when you go to high school, you got to have sex before you go in there. And I said, what? She goes, you have to have sex before you go to high school. Because everybody's going to know you're a virgin, and they're going to treat you bad. And I'm like, oh my God, what is this? I need to know. And she started educating me about, well, you're going to have to get a hot dog, and you're going to have to try to see if you can try to break your hymen. I'm like, what's a hymen? And so I'm like, I'm going to put food inside of my, and I was just in fear. I was petrified.
Now, did the Jewish girls have to use kosher hot dogs?
Any kind of input.
Well, see, this is the thing: is I came from a very religious school, and then I got thrown into a public school that was huge, and I had no idea. I was like, I better get on this thing about sex and putting food inside of me. I better get going on this.
Oh, that poor girl. Her misinformation too.
Yeah, and then boom. So at 14 years old, I had sex for the first time with a guy who was 18 and didn't understand what the hell I was
just
doing.
to get it out of the way because you didn't want to be laughed at or teased in high school.
And I didn't, and I had no idea what I was doing.
Gotten off of all medications.
So that was the story of my high school years.
We're going to talk about how
so that's just the beginning. So the thing is that it's really important to understand that education is very important. Otherwise, kids their imaginations run wild, and they start doing. And kids are curious. They experiment. They look around. And so. I know I want to be the one to sit down and talk to my kids. Yeah. I don't want to have some kid out there educating my kid, or some institution educate my kid, or somebody who could be very potentially dangerous. And so you have to ask yourself, what's your choice as a parent, and what are you willing to live with? And so what I am willing to live with is educating my child, over and over and over and over. Until they're like, Mom, do we still have to keep talking about this? Yes.
I think that's a good place to end our talk because that's an important thing. Start at
education.
The appropriate age and get that information.
Yes.
So people can make informed decisions.
And ultimately have a healthy sex life.
Yes. Well, thank you so much for talking to me. It's been a pleasure.
Absolutely.
And I really appreciate it. Say your name one more time for the people that might be listening to this.
Elena CLARK-FAHLER at Recovery Help Now in West Hollywood.
Very good. Thank you.